Good morning, everyone. All protocols observed. Happy Sunday to everyone today. So my topic for today is going to be on cervical cancer, as this is the month of cervical cancer awareness. So let me share my screen. This is going to be a two-part segment, as I don't want to overwhelm everyone with too much information. So I'll go into it slowly. So cervical cancer. So let me give you a little bit anatomy of the cervix. So the cervix has two main parts. The ectocervix, also called exocervix, is the outer part of the cervix that can be seen during a gynecological exam. The ectocervix is covered with thin, flat cells called squamous cells. The endocervix is the inner part of the cervix that forms a canal that connects the vagina to the uterus. The endocervix is covered with column-shaped glandular cells that makes mucus. The transformation zone of the border where the endocervix and the ectocervix meet. Most cervical cancers begin in the squamous cells in the transformation zone. So this is where most cancers are diagnosed. And this is what the cervix looks like. This here is really the cervix. So it's right here. If you can see where my control is actually moving. This is the canal that I spoke about in the external area. So what is cervical cancer? Cervical cancer is a cancer that starts in the cells of the cervix. The cervix is the lower and, again, narrow end of the uterus, the womb. The cervix connects to the uterus, to the vagina, the birth canal. Cervical cancer usually develops slowly over time. Before cancer appears in the cervix, the cells of the cervix go through changes known as dysplasia, in which abnormal cells begin to appear in the cervical tissue. Over time, if not destroyed or removed, the abnormal cells may become cancer cells and start to grow and spread more deeply into the cervix and to surrounding areas. This is, again, a picture of that. You can see the uterus is right here. The ovaries, the bladder is behind here, your cervix, and your urethra. What are the causes of cervical cancer? Cervical cancer begins when healthy cells in the cervix develop changes, mutations in their DNA. Various strains of the human papillomavirus. So cervical cancer is actually one of the sexually transmitted cancers as well. It's a sexually transmitted infection. It plays a role in causing most cervical cancer. That's HPV. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. So in other words, this can lay dormant for quite some time before it surfaces into cancer. Again, here's some causes of cervical cancer. So taking contraceptives for a long time, unhealthy lifestyle and diet, having several sexual relationships, smoking, the HPV virus, other sexually transmitted infections, and having intercourse at an early age, typically before age 16. Symptoms of cervical cancer. Early stage cervical cancer generally produces no signs or symptoms. Signs and symptoms of more advanced cervical cancer include vaginal bleeding after intercourse, between periods or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse. What are the risk factors? Again, I described some of them earlier, but I'll go through them again. Many sexual partners. The greater your number of sexual partners and the greater your partner's number of sexual partners, the greater your chance of acquiring HPV virus, because the virus can move from person to person. It can lay dormant, and then after a while, you develop cancer. Now, don't get me wrong. While the women develop cervical cancer, the men can develop penile cancer from this HPV virus. So early sexual activity, having sex again at an early age, and other sexually transmitted infections also are risk factors. Having other sexually transmitted infections such as chlamydia, gonorrhea, syphilis, and HIV and AIDS increases your risk as well. Other risk factors, as I discussed before, a weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition or if you have HPV. Infection with HPV virus is the main risk factor for cervical cancer, causing more than 90% of those diagnosed here in the United States. This virus is so common that it affects nearly 70% of sexually active women. Smoking, as well as exposure to miscarriage prevention drug. If your mother took a drug called DES while pregnant in the 1950s, you may have an increased risk of a certain type of cervical cancer called clear cell adenocarcinoma. The types of cervical cancer. Cervical cancers are named after the type of cell where the cancer started. The two main types are squamous cell carcinoma. Most cervical cancers, up to 90%, are squamous cell carcinomas. These cancers develop from cells within the ectocervix. Adenocarcinoma, cervical adenocarcinomas develop in the glandular cells of the endocervix. Clear cell adenocarcinoma, also called clear cell carcinoma or mesothelioma, is a rare type of cervical adenocarcinoma. Sometimes cervical cancer has features of both squamous cell carcinoma and adenocarcinoma. This is called mixed carcinoma or adenosquamous carcinoma. Very rarely, cancer develops in other cells in the cervix. Next week's topic, I will talk about the treatments of cervical cancer, when to see a doctor, doctors that treat cervical cancer, and support groups for those that may be diagnosed with cervical cancer. Thank you for your time. Thank you for your attention. I hope this information was helpful. Please feel free to join me in the Zoom room where you can ask me any questions. I'll be happy to answer them for you. God bless you and have a wonderful rest of the day.